What is coronavirus? Coronaviruses are a wide range of viruses that may cause disease in animals and humans. It is known that a number of coronaviruses cause human respiratory diseases in severity ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and severe acute respiratory syndrome (SARS). The newly discovered coronavirus causes COVID-19 disease. What is COVID-19 disease? COVID-19 disease is an infectious disease caused by the last detected virus of the coronavirus. There was no knowledge of this new virus and its disease before it began spreading in Wuhan, China, in December 2019. COVID-19 has now turned into a pandemic affecting many countries of the world. What are the symptoms of COVID-19 disease? The most common symptoms of COVID-19 disease are fever, dry cough and fatigue. Some patients may experience pain and aches, nasal congestion, throat pain, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but only very mild symptoms appear. Most people, about 80%, recover from the disease without needing hospital treatment. And the severity of the disease intensifies in approximately 1 person out of every 5 people who get COVID-19 infection, who suffer from difficulty breathing. The risk of serious complications rises among the elderly, and people who already have medical problems, such as high blood pressure or heart and lung disease, diabetes or cancer. But anyone can develop a COVID-19 infection with severe symptoms. Even people with very mild COVID-19 symptoms can pass the virus on to others. All persons with fever, cough and difficulty breathing should seek medical attention, regardless of age. What do I do if I have COVID-19 symptoms, and when should I seek medical attention? If your symptoms are mild, such as a slight cough or a slight fever, there is generally no need to seek medical attention. Stay home, isolate yourself and monitor your symptoms. And follow the national guidelines for self-isolation. But if you live in an area where malaria or dengue fever is common, you should not ignore the symptoms of fever. Seek medical help. When you go to the healthcare facility, put a muzzle if possible, keep at least 1 meter (3 feet) between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help them adhere to these tips. Seek medical attention right away if you experience difficulty breathing or chest pain pressure. Call your doctor in advance, if possible, so that they can guide you to the appropriate health facility. How is COVID-19 disease spread? People can catch COVID-19 infection from other people who have the virus. The disease is spread mainly from person to person through small droplets secreted by a person with COVID-19 from his nose or mouth when he coughs, sneezes or speaks. These droplets are relatively heavy in weight, as they do not move to a remote location, but rather fall quickly to the ground. People can catch COVID-19 disease if they breathe these droplets from someone who has the virus. Therefore it is important to keep at least 1 meter (3 feet) from others. These droplets may land on objects and surfaces surrounding the person, such as tables, door handles, and stair handrails. People can then become infected when they touch these objects or surfaces and then touch their eyes, nose, or mouth. Therefore, it is important to wash regularly the washing of hands with soap and water, or to clean them with an alcohol disinfectant to rub their hands. Who is assessing ongoing research on ways to spread COVID-19 disease and will continue to publish the most recent findings of this research. Can COVID-19 infection be caught from someone who does not have symptoms? COVID-19 infection is mainly caused by respiratory droplets secreted by someone who coughs or has other symptoms such as fever or fatigue. However, many people with COVID-19 infection have only very mild symptoms. This is especially true in the early stages of the disease. The infection can actually be caught from a person who has a mild cough and does not feel ill. Some reports indicate that the virus can be transmitted even from people who have no symptoms. It is not yet known the extent of transmission in this way. The organization continues to evaluate ongoing research in this regard and will continue to publish any updated results in this regard. How can we protect others and protect ourselves from infection if we do not know who has it? Caring for hand and respiratory hygiene is important at all times and is the best way to protect yourself and others. Keep at least 1 meter, 3 feet, between you and others when possible. It is especially important if you are standing near someone who coughs or sneezes. Since some people with the infection may not have symptoms yet or have only mild symptoms, keeping a distance far from everyone is a good idea if you are in an area where COVID-19 disease applies. What do I do if I had close contact with someone with COVID-19? If you had close contact with a person with COVID-19, then the infection may have passed to you as well. Close contact means that you live with someone who has the disease or was with them in the same place, less than 1 meter, 3 feet. But if you live in an area where malaria or dengue fever is common, you should not ignore the symptoms of fever. Seek medical help. When you go to the healthcare facility, put a muzzle if possible, keep at least 1 meter, 3 feet, between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help them. Adhere to these tips. If you do not live in an area where malaria or dengue fever is common, please follow these tips.